Hey guys, this is Dr. Hub. Today we'll look at the deep cervical fascia. So under the deep cervical fascia, we'll be looking at the modifications. So the deep fascia in the neck is condensed to form the layers such as the investing layer. So there is something known as the investing layer. So investing layer, it forms the roof of the posterior triangle. So it forms the roof. So it is nothing but the roof of the posterior triangle, and it splits to enclose, and it splits. And what does this enclose? So this encloses the parotid gland. So it encloses the parotid gland as well as the submandibular gland. Next we are going to look at the pretracheal fascia. So what is happening in the pretracheal fascia? The pretracheal fascia, it splits to enclose the thyroid gland to form a false capsule. So what it does, it encloses the thyroid gland. So it encloses the thyroid gland and it forms a false capsule. So what is special about this capsule? This capsule, it is thickened posteriorly. So posteriorly it will be thickened, and on the either side forms a suspensory ligament. So on either side they have a suspensory ligament. So what is the suspensory ligament called? The suspensory ligament is nothing but the ligament of Berry. So it is a Berry ligament. Then we look at the carotid sheet. So this carotid sheet, it formed anteriorly by the pretracheal fascia. So anteriorly it is a pretracheal fascia, and posteriorly if you see, it is nothing but the prevertebral fascia. Prevertebral fascia. So what does it enclose? So the enclosing will include, there is a common carotid artery, there is internal carotid artery, there is internal jugular vein as well as the vagus nerve. So there are two arteries, common carotid artery, the internal carotid artery. There is an internal jugular vein as well as presence of the vagus nerve. Then we look at the prevertebral fascia. So there is a prevertebral fascia. So the prevertebral fascia, it forms the floor of the posterior triangle. So this forms the floor of what? Of the posterior triangle. Forms the floor of the posterior triangle as well as the axillary sheath. Inferiorly, what is the special? Inferiorly, it blends with the anterior longitudinal ligament. Inferiorly, it blends with anterior longitudinal ligament. Now let's look at the buccopharyngeal fascia, BPF. So in the buccopharyngeal fascia, it covers the outer surface of the pharyngeal constrictors. So it is a outer surface of the pharyngeal. So it forms the outer surface of the pharyngeal constrictors and also the buccinators. So it forms outer surface of the pharyngeal constrictors as well as the buccinators. So posteriorly, what is the? In posteriorly, it is separated from the prevertebral fascia by the retropharyngeal space. So it is separated from the prevertebral fascia, and this is by a retropharyngeal space. Lastly, we look at the pharyngobasilar fascia. So what is the pharyngobasilar fascia? So this pharyngobasilar fascia, it fills a gap. So it fills the gap, and this gap is between the superior constrictor and the base of the skull. So this is between the superior constrictor and the base of the skull. Now we have read this. Now let's try to picturize all of this. So let's look at the diagram, that is the transverse section of the neck. So this will be anterior, this is going to be posterior. Now the outermost layer, this we will call it as a skin. This is the skin. Now we will form another inner layer. This inner layer is going to be enclosing a muscle. So let's draw the outlines properly. This will be the trapezius. This is going to be the trapezius. Writing short forms to accommodate the space. And next there will be another layer. And between all this we will have the spine. Now here we will have the gland. This will be the thyroid gland, and there is going to be a muscle which is enclosed. This will be the SCM, that is sternocleidomastoid, on each side, and there will be a group of structure 3. So what does this include? This structure, let us make it bigger. So this structure, it includes the presence of the internal jugular vein. So this is nothing but the IJV, internal jugular vein. Then there is also presence of the common carotid artery, as well as there is presence of the VN. VN stands for the vagus nerve. So it contains the internal jugular vein, it contains the common carotid artery, as well as the presence of the vagus, presence of the nerve, vagus nerve. Then there is also presence of the sympathetic chain. There can also be there is presence of the sympathetic chain, sympathetic trunk, which is present. And let's look at the muscles here. The important muscle here will be this will be the scalenus anterior. It will be the scalenus anterior. So what are the fascia? This is going to be the inner fascia. This will be the prevertebral fascia. So it is the closest to the vertebra. It will be the prevertebral fascia. And this is going to be the outer layer. This will be the investing layer. This will be the investing layer. And we saw what is the trapezius. This will be the trapezius. And the skin also we have seen. Then comes the fused buccopharyngeal. The fused buccopharyngeal and the prevertebral fascia. So when we see this thyroid gland, this will be enclosed. So this point will be this point. It is known as the fused. It is a fused buccopharyngeal. It is a fused buccopharyngeal and the prevertebral fascia. Fused buccopharyngeal as well as the prevertebral fascia. So below this comes the pretracheal fascia. So here there is a pretracheal fascia which is also present. Then in the posteriorly we saw here there is going to be the scalenus anterior, and here same way the posteriorly these are known as they are nothing but the muscles of the back. They are muscles of the back. So this was a rough representation of the transverse section of the neck.